My name is Rainer Halenke. I'm the owner here of the cattle and hunting ranch Schornau. We are about 50 kilometers from capital of Windhoek. It takes about 50 minutes to drive out here. At the moment I have 4 houses occupied, so it's around about 15 to 20 people.
Farm Access Foundation is a Dutch nonprofit working to improve access to quality healthcare services by strengthening the private health sector across Africa. In 2010, Farm Access Namibia launched the Mr. Sister Mobile Health Service, an innovative program created to provide primary healthcare to employees and their families living in rural and remote areas of Namibia. More than half of all Namibians live in rural areas, making physical access to a healthcare provider a real challenge. What began as a pilot program in 2009 has grown into a full-fledged rural health service, delivering primary health care to over 1,000 patients per month.
I decided to join firstly to see if it really helps me out, that I can cut down on tours to town to bring sick people to the clinics or hospitals. And I found out that later the people really didn't come and ask me for either medication or for a drive to town. So I really also cut down on my fuel costs as well. To be honest, I really have the feeling that the health of my employees also increased, because it is much easier for my employees to get medication or seeing at least a nurse, to get a little bit help on their health issues.
Mr. Sister uses a unique mixed funding model to leverage both public and private sector resources in covering the cost of delivering these services. The Ministry of Health, which would otherwise provide treatment to the same patients at the nearest health center, supplies the necessary drugs and vaccines used by the clinic. Commercial farms and other local businesses are contracted and pay a monthly fee to cover some of the costs of bringing health care to their employees. Donor funding and corporate social responsibility contributions help fill the gaps in funding. This model then allows Mr. Sister to deliver the same services to communities along the clinic routes that would otherwise not be able to afford them. For example, funding from Namibia Medical Care, a local private medical aid fund, is cross-subsidized into providing services to poor communities and nonprofits that look after orphans and vulnerable children.
My name is Ilanza Kutsia and I'm the country manager for Orange Babies in Namibia. We became involved with the Mr. Sister Clinic at the beginning of 2012, where the Mr. Sister Clinic goes out once a month to provide primary health care to the 400 children, which is part of the feeding scheme at Ileni.
The results of a 6-month study among children at Ileni and other clinic sites that serve orphaned and vulnerable children showed improvements in immunization coverage and reductions in both parasitic infections and cases of childhood anemia. As a non-governmental organization, Mr. Sister has greater flexibility in scheduling staff, maintaining vehicles, and expanding coverage to meet the growing demands for healthcare services. People who would otherwise travel to a government clinic now access care closer to home. Employers save on transport and other medical costs, and those who have the least are not left behind.
On behalf of the Office of the President and the Office of the First Lady of the Republic of Namibia, we are so pleased that the government has played an integral part in this innovative private-public partnership in the provision of health services, and we look forward to its continued success and expansion for the benefit of our people. Keep up the good work.